Okay, so you're going to get your Achilles tendon rupture fixed. Let me tell you everything you need to know about surgery and the expected post-operative course. And first of all, the Achilles is a very strong tendon, and oftentimes the injury occurs with running and jumping, and people will feel like someone kicked them in the back of the leg. You'll have the inability to put your foot down, particularly if you're standing and putting weight on it. And a lot of times we'll get an MRI. Oftentimes we won't, but certainly an MRI can confirm whether there's a gap or not. Surgery is often indicated, especially when people are young or active or really just want a predictable recovery. So what does that recovery look like? First of all, in order to have surgery, we have to make sure you're healthy enough for that surgery. That means you have to get the appropriate preoperative lab work and medical clearance in order to undergo any anesthetic, right? There are risks with anesthesia, and we want to make sure those risks are low. Number two, when you have your Achilles tendon rupture, you actually disconnect the calf muscle. The calf muscle is not only responsible for pushing you or allowing you to jump, but it's also responsible for pushing the blood in your leg up back to your heart. And so when that blood has an opportunity to pool, you're at an increased risk for a blood clot or a deep venous thrombosis or a DVT. Having a DVT can typically experience, having a DVT is at risk for your health because it can turn into what's called a pulmonary embolism. That means that the clot from your calf can go up to your lungs and result in shortness of breath. We obviously don't want that. So what signs can you look out for? You can look out for any calf tenderness, any swelling, any redness around your calf muscle. You can make sure you're still pumping and moving your knee. That'll certainly help. And in certain patients who have an increased risk of blood clots, I will prescribe some anticoagulants. So those are really the big risks when it comes to anesthesia and the injury itself and the surgery. So what can you expect after surgery? So after surgery, you can expect to have an incision like this. Typically, there's an incision above where I access the tendon, and there's two incisions below where I'll take anchors and essentially connect the top of the tendon to the heel. A variation of this could be a smaller incision, a slightly larger incision here, and a direct repair through the tendon itself. Immediately after surgery, patients will be in a splint with their foot pointed down. So that means that your foot will be pointed down to the ground. You'll be in a splint in this position here. I typically will leave people in that position for about 3 weeks. 3 weeks is the sweet spot for me because that tissue really has enough integrity for you to start to put some weight on it. And so I'll wait until that point. So let's fast forward. You're 3 weeks after surgery. I remove you from the splint, and then you're going to go into a boot. The boot will allow you to point your foot down. There's absolutely no pulling up after surgery. Really, at least up until 8 weeks after surgery, I'll instruct patients not to do any upward motion and only work on what we'll call the gas pedal. Pushing down on the gas pedal and actively firing that Achilles tendon. That's what I want you to work on. No stretching at all. That'll come with time. When you're in the boot, you'll start off with some heel lifts. That'll allow your foot to stay in a pointed position while you start to apply some weight. I typically will tell patients to remove one heel lift either once a week or every 2 weeks, depending on the repair and the recovery itself. At around the 8 to 10 week mark, my goal is for patients to be at 90 degrees. That means all the heel lifts are removed and they're flat in the boot at about 8 to 10 weeks. I like patients to start physical therapy at about 3 weeks after surgery. Again, working on strength, only not doing any stretching. I usually will see patients 3 weeks after surgery and then at the 6-week visit. At the 6-week visit, I'll instruct you to do some standing weight-bearing exercises. Again, working on strength, keeping most of your weight on your good foot, but actively firing that injured or surgical side. Most patients can return back to sport. We're talking about running, jumping, at about 4 months out. In the meantime, I progress you doing some non-dynamic aerobic activity. We're talking about toe raises. We're talking about gradually transitioning into lunges, box step-ups, getting on the bicycle, walking on the treadmill, using a rower, and of course, doing any upper body or leg type exercises that you can. The most important part is no stretching. We really want that length to be controlled, and strength is the key with the recovery. If you have any questions, let me know. I wish you a happy recovery. See you in surgery.